And joining me on the ward now is TVC News Correspondent Esther Omopariola, who just returned from Morocco. Good to have you join us, Esther.
Thank you.
And welcome back from Morocco. But let's start with your trip there. I mean, you had to go through some checks at the airport, I'm guessing. So tell us some of the things you saw at the airport and how prepared is Morocco for to deal with this virus?
Coronavirus. Well, when I returned, that's when the seriousness began. But when I entered into Morocco, there wasn't any of such preparedness, more or less, in the airport, because they only gave us a form to fill while we were in the airline. Just more like a form to declare our status, if we're okay, we have any headaches or any of those things. So we just filled it before we landed in Casablanca in Morocco. So when we got there, the airport checks, there wasn't any sort of, thermometer checks like we have in our local airports. When you return, there's a thermometer gun on your head to check your temperature. That's in Lagos Airport when we returned. But when I got to Casablanca in Morocco, there wasn't any of such. We just got to the control section where the passports are being checked, and you're asked basic questions. Okay, you're here for this purpose and that, and then you're allowed to go in. But when we were coming back to Nigeria, a lot of people, I could see they were wearing face masks. People were with hand sanitizers. That's indigenous, may not be Moroccans, ordinary citizens, from different parts of the world that are trying to leave the country, leave Morocco to other parts of the world. So some of them were wearing face masks, some of them were with gloves, some of them were with other protective gears. But at the airport, there wasn't any of such screenings. That's in Casablanca when we were leaving. So when we got to Lagos, that's when we saw the whole, paparazzi of almost all the health officials were well kitted in health protective gears. Some of them wear face masks. At each point, we saw hand sanitizers. You had to, clean your hands at every turn, and they were also given forms to fill. So in case
same form you had to
that we had to fill when we got to Casablanca. So when we got to Lagos, we also filled the same form. So the forms were to identify, okay, where you're coming from, where you're going to, and possibly your phone number. So in case maybe among us, if there's any case, they can reach, and also possibly trace any member of who are, in the flights.
While it is a good thing to hear that Nigeria is doing all the checks, Morocco doesn't look like they're doing any check, except maybe there's a check somewhere we don't know about. But what does that say to you about preparedness to contain this virus in Africa?
Well, I would say, in Nigeria, we have this mentality to, protect ourselves, protect our immediate environment against anything. For instance, I can recall what happened during the time when we had Ebola. Everyone was, trooping to the stores, getting hand sanitizers, washing hands as regularly as possible. But, in Morocco, when I was there, I didn't see any of such frenzy that we had when we first reported, we have a case in Lagos. Everyone was like, okay, on social media, everyone was saying things, what you should avoid, how you should quarantine yourself if you have any cases of that. But in Morocco, when one case was reported, everyone was living life normal. Because when I even asked one or two persons, you guys have coronavirus, what are you doing about it? They were like, well, if it's here, it's here. There's nothing for us to worry about. I think from their own perspective, they see that if it is the Lord's will that coronavirus is in Morocco, why should we worry? But some were like, Morocco is immune to coronavirus. We cannot have coronavirus. It's like, for instance,
they have about 3 confirmed cases now, and
they even have 6.
6 now, and there is a death. One death has been recorded.
Absolutely.
So that should be some sort of wake up, and it's some sort of concern for the government there to say, let's do something, or for citizens to, at least be not panic but take precautionary measures. But what does this say about protecting borders? Because while it looks like some countries in Africa are doing a lot to ensure that they contain this virus, it might also look like some are not doing as much as others. So should we start to protect our borders?
Of course, we should protect our borders, right from people. We already hear Americans, banning travel from Europe into the United States. So nothing stops other countries in Africa to do likewise, because most of these viruses are imported that we have in Africa, they're imported. If you check what happened in Nigeria, an Italian came to Nigeria, that's how we got this case. What happened in Morocco, a Moroccan man came from Italy, that's how the virus came. I think that should be the same cases for other countries in Africa, Senegal, Algeria, Tunisia, and others in Africa. So most of the cases we understand are imported from these countries outside the African continent. So what is expedient for African governments to do, like we've seen in the United States, is to ban travel to an extent, to, let me say, to a certain number of days, so that we know that we can handle this, because already we know that our health system in Africa is not as strong as we see in other developed countries where, you know, they have everything at their disposal, they know how to handle emergencies. But in Africa, where the health system is far from getting there and we're still struggling, so why do you want to burden what we have, or, you know, make a lot of strain? So the best bet we can do as a people in our continent is to, you know, ban travel to an extent, if at all for some days, maybe 30 days. Let's see how we can manage or contain the virus that we have right now. So if we're able to contain it, then we can at least open the doors for others to come in, than to allow people to come in and then we will be overwhelmed by the level of cases that may, you know, come to bear at the end of the day. But it's still a work in progress on the part of the Nigerian citizens, you know, protecting themselves, washing hands, sanitizers and everything. Each is a plus, but we still need to go a little bit further than that.
All right, let's talk about, because you now have an experience in a country where it didn't look like anybody had any sort of concern or panic about the coronavirus. So when you hear the Director General of the World Health Organization, Ghebreyesus, saying, look, this looks like the first pandemic that we can control. When you put that side by side with your experience in Morocco and, you know, in Nigeria as well, what do you think? Did you see any pointers to the fact that, look, this can be controlled?
Yes, we can control this, because already as a people, like I said earlier, we at the ports, I could see, you know, health officials taking the bull by the horn in terms of, okay, ensuring that everyone who is coming in, you are checked. There is a level of, you are checked. You're not allowed to go in without any level of check. And then the people themselves have hand sanitizers. For instance, majority of the African journalists that converged in Morocco for the deliberations that we had hand sanitizers. They were well informed.
Those are individual